Hey guys, welcome back to another Surgical Tech Tips. It's been a bit, and I feel now is the right time to come back at you with a video just talking about this pandemic situation that's going on right now in our healthcare and in our world. It's hitting us all, and it's hitting us all pretty hard. I'd like to take this time on the video to kind of go through the steps that I've seen at my hospital. I guess starting with, the first kind of step that happened is everybody kind of had a doubt, I guess you could say. We started to hear things about, in the news about this Chinese coronavirus that was happening out in China. It was highly contagious. We had heard some things about it, and we had heard that it might be deadly, but no more deadly than the flu. So everyone just kind of wrote it off as, oh, it's no worse than the flu. It's not going to be a big deal, blah, blah, blah. The flu kills more people than this, blah, 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 blah. Obviously, the experts in the field felt a lot differently, and they were giving us higher numbers, but I feel like we, the public, didn't really recognize that and didn't really take it to heart. So that was kind of like the first step in our healthcare here in America, and at my hospital. It was all just kind of hearsay. The second kind of step into it was when we started to see a manufacturing slowdown in sterile gowns, drapes, and certain supplies that we get shipments from China. Obviously, China shut down manufacturing and basically shut their country down for, 2 months, essentially. So we obviously rely a lot on manufacturing from China, and we started to see shipments stop, essentially. When that happened, we had, an outcry in the hospital and a notice in the hospital to start utilizing, try and only utilize 1 gown per case. If you did use extra gowns or you had too many gowns open on the field, make sure you save the gown after the case is over, and we would set them aside for later use. Maybe we could re-sterilize them or something like that. So we were kind of like stockpiling gowns that were open on a sterile field but not necessarily used, just in case. Well, when that started happening, it was kind of like, usually when you come in and you have a case load, first thing in the morning, you may like set your case up and then go break to have some breakfast and pop your gown off and throw it away and go have some breakfast. But when this was instituted, it was more like, okay, nobody needs to be setting up, 30 minutes ahead of the case start. Let's wait until the patient rolls back into the room before we open up these cases and open up these drapes and these gowns and stuff like that, just so that way the scrub tech is not going to be scrubbing out and stuff like that. They can just open up their field, scrub in, set up, and by the time they're done setting up, the patient's ready, we're prepping, everybody's good. So that was kind of step 2, is when we started to see kind of manufacturing slow down. Step 3 is when we started seeing coronavirus patients in the US. And then I feel like our healthcare system was kind of on alert. We all kind of woke up and we're like, oh, okay, it's in our home. Like this is a deal. The White House and our government are making a big deal out of it. There were still, people on both sides of the argument saying, oh, it's not going to be all that bad. It's not going to be all that bad. Meanwhile, the government was obviously taking severe measures and thinking about, worst case scenarios that could possibly be in place in the very near future. So we were all kind of getting on high alert, and we were kind of recognizing the situation and that, you know, it had the potential to get worse. We still continued with, you know, rationing our gowns. Kupo, sorry, I got the window open and the doggies go crazy. So we were still trying to kind of ration our gowns, and any extra gowns that were on a field, you know, still same thing. We were saving them, setting them aside. At that time, they had taken all N95 masks out of the OR and completely locked them up. Partially because, you know, they wanted to save them for you know, specific use and things like that, but also because there had been a high volume of things getting stolen. I don't necessarily know if it was happening at my hospital or if it was just happening across the US, but boxes of masks started to, you know, fly off the shelves, and as far as I know, just millions of dollars worth of product was being, you know, swiped up from hospitals, and it was becoming an issue. So that brings me on to step 4. That's when our COVID-19 patients started happening locally. And that's when it felt like it was really close to home. We have, you know, I have some friends close to me that I work with that had done a bronchoscopy on what turned out to be a positive COVID-19 patient. And that person and her significant other had to self-quarantine for the past 2 weeks. I hadn't seen them in 2 weeks, and they had self-quarantined themselves. They did the right thing. They did not test positive or anything like that, but, you know, they had done a bronchoscopy on this positive COVID-19 patient, and at the time they did not know it was a positive coronavirus patient. So it was very scary, and it was very, very close to home. And that's when I think everybody in my hospital started to kind of wake up to the situation a little more at that moment, when we had our first legit case here locally. And as you've seen in the news, every day it doubles, triples, and it just gets more and more and more. So literally the following day, we can call that step 4 or step 5 or whatever, they started locking up all bottles of alcohol, all bottles of hand sanitizer, all of our soaps. All of these things were being swiped out of our hospital by what I would guess would be employees or, you know, other hospitals. It happening in other hospitals, and it was just mandated that all hospitals in, you know, our healthcare system put all of these types of supplies on lock. They came out with a mandate that all hospital employees were no longer allowed to bring any type of bags into work, and if they did, they had to be clear bags. If they were not clear bags, they would be subject to search every time you come into the hospital, and anybody found with anything from the hospital would immediately be terminated on the spot. There have been several employees that have been terminated on the spot because of that. It was crazy. And then meanwhile, as soon as that happened, the day that happened, our governor here in Nevada essentially shut down the entire state to only essential businesses. So all schools were closed. Basically, the entire Las Vegas Strip is closed. All the hotels and everything is very eerie. Tons and tons of people have lost their jobs in that industry. The unemployment here is massive for it being such a tourist-based community and service-based community. It's very heartbreaking to see. As well, on this step 4 or 5, the hospital administration took to heart, you know, what the Surgeon General of the government had said about asking hospitals to stop doing elective surgeries, and they decided that the surgery department would be open, but they were leaving that decision up to the surgeons themselves. So the surgeons could decide, you know, what was an elective case and whether or not they still wanted to do an elective case or consider them emergencies. And I would say probably half of our surgeons decided to stop all of their elective surgeries. Obviously, there's still plenty of cases where, you know, you're taking cancer or, you know, removing cancerous tumors out of somebody, you know, that's going to keep growing. So that is technically an emergent thing to take care of. And, you know, hearts, vascular, stuff like that. But it's been pretty crazy. And then just today, they've taken all masks away. Just not just N95s, literally all surgical masks have been taken away off the shelves. This is what the shelf looks like now. They've locked all of that up. They've essentially stated that we want to try and keep mask usage down to 1 per person a day, unless it's, you know, visibly soiled. So this is against all guidelines and everything that we've had to do in the past. And, you know, everyone's just kind of winging it and do the best we can with what we have. We're in a scary situation where, you know, we as US healthcare workers might not have, it's not might, we do not have the amount of PPE required to take care of the potential amount of COVID-19 patients that are going to erupt in this country. We do not. Our government's working hard on trying to, you know, manufacture ventilators that we're going to need. You know, I heard something around the realm of like 750,000 or something like that, or 75,000. I can't remember the exact number, but it's a very scary situation. I'm sure, you know, when I go back into work on Monday, we're going to hear that all elective cases have been canceled. Luckily for now, you know, we still have our jobs. You know, we have PTO that we can use to cover some of this time that we have off. I've been reading things on Facebook groups and stuff like that across the country of nurses and techs that, you know, have stopped operating because all of their elective cases are gone. Surgery centers closed down, people fired because they're not operating anymore. People floating around the hospital because their hospital is just drowned with COVID-19 patients and they just don't have enough staff to even screen these people. So they even have, you know, techs and circulating nurses going down there to help like screen patients. It's a very scary situation, and I foresee this getting a lot worse, and it's going to keep getting a lot worse until it gets better. I don't know when it's going to get better, but I feel like it's going to start getting pretty insane here. You can already tell in places like New York and California and Washington, the places that were hit the hardest first. I don't have any personal contact with healthcare employees there, just things that I've heard from other surgeons, and it sounds like we're not prepared for this at all, and that's a very scary thing to think about. Very scary indeed. So yeah, I just wanted to make this video and put it out there because I do care about all you guys out there, and I wanted to make you know that I was safe, my family is safe, my kids are, you know, home. They're all quarantined. My wife's home, and we're doing our best homeschooling our kids. A situation that, you know, we didn't think we'd be put in. We're like day 5 now of the homeschooling quarantine, and, you know, we're at each other's throats every now and then, but I think, you know, the kids are starting to get the gist of it and they understand what's going on, and hopefully we get into a good routine of keeping up with our schoolwork and things like that. But I hope all you guys out there stay safe, and if you are working in those hospitals, screening those patients and everything, please stay safe. And if you feel any type of symptom, stay home, self-quarantine. The best way that we can combat this is separating ourselves. The whole social distancing and self-quarantine, when you feel any type of ailment, it's absolutely key in this situation. Absolutely key. It's the best way we can combat this. So if there's anybody out there that has any other crazy stories they want to share, go ahead and write them in the comments below. Any of you out there maybe working in New York or California or anywhere, you want to share something, please share it with the community down below in the comments. Love you guys. Hope you all stay safe. Thanks for watching. I'll see you again. Bye.